If you clicked on this video, it's probably because you just secured admission into a nursing school or a department of nursing and you're curious about what to expect, or you're just curious like what is nursing really about. You know, when you think of nursing, probably what comes to your mind is just injections, and you can't exactly differentiate what nursing is from other healthcare professions. In this video, I am going to be doing my best to bring nursing to you, explain to you, break down what nurses do in the hospital in layman's terms. Okay, let's go. Hi guys, welcome back to my YouTube channel. If you're here for the first time, hi, my name is Busari Molayo and I'm a registered nurse living and practicing in Nigeria. On this channel, I film content related to nursing and healthcare, and in today's video, just like I said, I'm going to be describing nursing to you. So if you're interested in content like this, do click on the subscribe button to join the YouTube family, and also on the bell icon so you get a notification whenever I drop another amazing video. So let's get into the topic for today. So as a child while growing up, when you hear the word nursing, what comes to your mind majorly are those matrons with their white caps and injections. That's what comes to our mind. Or a lady that's probably carrying a file and following a doctor around in the hospital. That's what most people think that nurses do. You know, for pharmacists, when you hear them, first thing that comes to your minds are probably drugs. When you hear physiotherapy, first thing that comes to your mind are probably bones and massage, even though that's not all what they do. When you hear doctors, first thing that comes to your mind is prescribing or doing surgeries. And when you hear like a whole lot of other healthcare professions like health records, you know, okay, fine, these people document or keep records in the hospital. But for nursing, people just think, okay, these people assist doctors, or probably we just carry files, following them around, and we give injections when we're told to. But that is wrong. Nursing is way broad than what people think it is, and that is what I'll be explaining in this video. So to start with, how did nursing even start? Nursing is as old as man. Trust me, like we've had people caring for other people since man has ever existed. One person has had to care for another person, and caring is actually the foundation of nursing. Like that is what the foundation, yes, I already used the word foundation. Now that's like the bedrock of what nursing is built on. But there is a lot of science that comes into caring. That's what makes nursing different from just like your regular acts of caring for another person in your neighborhood, in your family, or you know, your class or something like that. So the science that is imbibed into the caring role is what makes nursing distinct. That is number one. That's not all, just number one. So when science became imbibed into nursing, that is what we now have today as the modern nursing. I hope you get my point. Like before the advent of modern nursing, people have been caring for other people, but the science was not really there. So when science became merged into nursing, that's when we got modern nursing. And the woman who started this is who we know as Florence Nightingale. She is referred to as the mother of modern nursing. She came up with different theories, a lot of scientific rationales for everything, not everything, sorry, because there are a lot of nursing theories, but she started that role of imbibing or including science theories, scientific theories, and so many other things into nursing, making it a science, more of a science than an art. Do you get my point? So if you want to know about Florence Nightingale, you can easily check Google. Her story is all over the internet, and she is the mother of modern nursing. So what exactly is nursing? Because I just said that, you know, you included science into caring, so that makes it different from what other people do. But what exactly is nursing? Nursing has been defined by so many nursing theories. Well, we have one popular definition, which is by Virginia Anderson, and she defined nursing as assisting an individual or assisting the individual, sick or well, in performance of those activities contributing to health or its recovery or to peaceful death that the individual would perform unaided if he had the necessary strength, will, or knowledge. Now that definition is actually very, very broad. It's a lot, and every nurse now, or I don't know about nursing in other countries, but for Nigeria where I schooled, we all had to memorize that definition at the beginning of our nursing program. So that is like a summary of what nursing is about. a summary, not all. So what you do basically as a nurse is that if a person comes into the hospital, you're like the leg of that patient when the patient cannot walk, you're like the hand of that patient when the patient cannot lift things. You have to assist that person to perform activities just like Vaginandesi said that he would have done on his own, or she would have done on her own if she had the strength. So someone comes into the hospital, and I feel this is the foundation of so many things that we call nursing procedures. I hope I'm not confusing you. If you're confused, you can always leave questions in the comments section. So this is where we have a lot of nursing procedures coming out from. A patient is on the bed, cannot bathe themselves. That is why a nurse has to do bed bath. The patient cannot brush their teeth. That is why there's something called oral care. The patient cannot get out of bed. That's why there's something called lifting a patient. The patient comes to the hospital. The patient cannot eat on their own. That is why there's a procedure called feeding the patient. The patient is cannot move out of bed on their own, or they have to sleep on bed a particular way that they would have done on their own. That's why there's something called positioning of a patient. These are some of the very few of the numerous nursing procedures that we have to learn in school. So now that you know what the definition of nursing is, what is the essence of science, before I now move on to start describing or distinguishing the roles of a nurse in the hospital. You can't help an individual without fully understanding what the body is, or what the human body contains, or what it consists of, or how the human body works. That is why at the entry level of your nursing program, you are going to learn anatomy and physiology alongside your regular foundation of nursing, that the procedures that I mentioned earlier on. So now we're talking about what you're going to be learning in school as a nurse. Now that you know, like, what you have, like a basic knowledge of what nursing is. So you're going to be learning how the human body works, how the human body is structured and how it works. That is anatomy and physiology. That's why you're going to be in class with other medical students, like the MBBS students, the pharmacy students. You're going to be in class with MLS students. You're going to be in class with physiotherapy students. You're going to be learning how the human body is structured and how it works, because you can't care for what you don't understand. So that is why there is a lot of science in nursing. That's why it's not just in nursing. The course is not just nursing. It's called nursing science. Do you get my point? So after learning the anatomy and physiology, you know, you're going to be administering drugs for your patients. So you're going to be learning pharmacology as a nurse. Then once you learn the normal, you know the anatomy and physiology, you now have to move on to pathology. You know the normal, so you need to understand the abnormal. So for example, you know how the heart works, how the heart should be normally. So you should know how once it becomes abnormal, you should be able to identify it. So that's where you proceed to take courses like medical surgical nursing. And because you're going to be working in an organization, you're also going to be taking courses like management, probably towards your final year. But there are a lot of courses you're going to be taking. You're going to take anatomy, like I said, physiology, med surg, pharmacology. You're going to take biostatistics. You're going to take epidemiology. You're going to take management. You're going to take courses like computer science, because obviously you use computers in a hospital. You know, there are so many courses that you are going to take as a nursing student. You're going to take mental health and psychiatric nursing. You're going to take public health nursing. You're going to take maternal and child health nursing. There are a lot of courses that you would have to take as a nurse. So now you're seeing that all you're going to learn is not just injections. No, it's not about injections. It's not. In fact, injection is not even up to 0.01% of what you would do as a nurse. So now when you get to the hospital, what exactly are you expected to do? You're going to be collaborating with other healthcare professionals to take care of the patient, because the patients are the biggest stakeholders, or are the major stakeholders when healthcare is concerned. Everybody's goal, the doctor, the nurse, the physiotherapist, the pharmacist, everybody, the med lab scientist, the goal is for the patient to be better. So your role as a nurse now goes back to what I've said earlier. You're going to be doing your nursing procedures daily to make sure that the patient is properly cared for. That is one of the major roles of a nurse that no other healthcare professional can do. Nobody can care for the patient the way a nurse will care for the patient. They might have their own procedures, but you're going to be with that patient. You're going to spend the most time with the patient, and you're going to be caring. Caring is the bedrock of what nurses do in the hospital. So you're going to be caring for the patients. But you must also have a good knowledge of what other healthcare professionals are doing, so that you don't care for the patients wrongly. Now, when it comes to the science that goes into nursing, is actually broad. I don't think I've even exhausted 10% of it in this video. But if you want to make a video about the science in nursing, let me know in the comment section. But now, at least, if you're going to school now, you have an understanding of what you're going to school to learn, or what you're going to be doing in the hospital after you graduate. I hope this video was not, in fact, I feel even now I feel I didn't put a lot of information in this video, but I'm going to be taking questions in the comment section. And before I end the video, I'm going to say that nurses have their own autonomy as professionals. Like nurses, they have their own autonomy. There are certain decisions that you can take on your own as a nurse. So you are not a maid or an assistant to any other healthcare professional. What you guys do is collaborate. You guys work together, you collaborate. You're entitled to your own assessment, you're entitled to your own decisions when you're caring for your patients. And what you do with other healthcare professionals is that you collaborate. If I've confused you in the course of this video, because there's so many information that I did not put in this video, I keep saying it because nursing is broad. One video cannot explain what a nurse does, it can only summarize it. So if there are other things you feel, if you're a nurse, you're watching this, there are other things you feel I should have put in this particular video that I did not do, please leave them in the comment section, and I'll see you in my next video. Bye.